We knew that when the pandemic came down that we needed to grow, and we needed to grow very, very quickly. We grew VA telehealth 1,400% in a matter of 4 months.
We built 96,000 brand new user accounts for VHA. We created telehealth dashboards that give us visibility into the telehealth system so that we could rapidly expand it.
It really changed kind of how OIT is viewed and really highlights our capability and commitment to excellence.
We were brick and mortar showing up somewhere, all getting together. And so we had to quickly adapt to that.
We needed to test our gateway connections for VPN access. OIT's very fast response to the growing need to telework that was coming. We were able to definitely get ahead of it and make sure that there was no impact felt by the VA staff, and then of course that the veterans were still able to receive the services that they needed.
We were still able to provide care to the veterans that we serve in a way that actually could keep them healthy.
When you're looking at the impact of the IT system and its delivery of care for VHA, I mean, you're looking at 50% of all of our interactions with veterans were through these systems that my team gets up every day to make sure is available.
The ability to allow veterans to easily schedule a vaccine.
The team got together and in less than 3 months had a system in place to manage the vaccines. And then 10 days after that, were able to watch as over 70,000 vaccinations actually occurred.
Innovation is our key to success in IT.
We want to offer the customer the best way they want to receive the service. What are they looking for on the URIT portal, and can we move that into a chatbot, an automated way using the AI technology that's built into that portal to walk the customer through the solution that they're looking for? Because we implemented another form of AI technology in our monitoring system, we were able to see errors for the first time, get them corrected, and that allowed us to increase our capacity on the telehealth system by twofold at least.
A rural community, it has quite a few obstacles. Some of these areas, you're reduced to basic phone service.
We don't want veterans have to pay for their access into the care into the VA. So we've worked with carriers to have a zero rating program so that if you use your mobile device to do a video call, it's not being charged against your data plan.
We've got satellite dishes that we're able to use. We have our MiFis and things we're able to use over the mobile networks. We're able to basically take the data connections from the cell towers and support that facility and do patient care and cut those commute times down for the vets and the workers.
Another program with rural veterans, this thing called the Atlas program, where you have kiosks. Veterans can sit down in this booth and they can connect to VA resources that way.
I'm a veteran who's been using VA for about 20 years now. Prior to the last maybe 10 to 15 years, I had to go fill out a form and then walk into a VBA regional office or either mail my application. So for me to pick up my phone and to get access to services and benefits and talk to my physician through secure messaging, those are the tools as a veteran that I feel like that are necessary for me to operate in my world.
We've had to be there, on a moment's notice to basically help ensure the safety and security to facilitate this remote work situation.
We turned around an entirely new enterprise collaboration platform. Cisco WebEx had it from contract award to in operations within about 3 months. We needed to stay focused on proved solutions because we can ensure that those are the most secure environments around.
Whether it was figuring out how to stand up remote support or figuring out how to do things differently, everyone understood their role in that and everyone got on board with that.
I love working here. It offers a lot of opportunity to do really important things.
I was able to work for different people. I was able to, learn different things, go to different trainings, gain different skills.
Typically, when you look at IT as a whole, very seldom do you see women and very seldom do you see minorities. They are making a real intentional effort. Just last year, I was a part of the Women in IT campaign.
We have maintained high standards of service delivery. And in fact, I would say we have actually increased our productivity and our efficiency in many regards.
They've seen a massive uptick in satisfaction.
From an employee standpoint, it makes you feel good to know that we are providing a platform that veterans feel that value. They feel like the VA is there for them, that we are capitalizing on that promise that Lincoln made.
This particular team spent about 5 seconds celebrating. It was more on what's next.
We're looking forward to the future and start to do some of those really advanced, AI things and automations, virtual agents in the contact center space.
And we want to continue to build on that because it's not just IT, but rather how we change our business policies, practice, workflow, the data elements that we need, and also the systems that we need. So again, we can improve the posture of the VA for future events.
To win.
To win,
To win,
we have to.